waiting lists. They stand at 7.8 million people. That, by the way, is a fiddle. It's much, much higher than that. Now, the British Medical Association, which is the trade union of doctors, has morphed from a benign body representing doctors' best interests into a nasty, vindictive, left-wing group determined to topple the government. This is my personal feeling, but doctors like Vivek Trivedi, Rob Lawrenson, Emma Runswick, who, by the way, is a former Momentum activist, should be ashamed. They are making patients suffer in pain and distress. And, make no mistake, people will die as a result of this action. Now, consultants and junior doctors are now bragging of their camaraderie. They're doing so openly on the British Medical Association website. And let me tell you this, at the same time, while saying this, they're profiteering. They're commanding as much as £7,900 to cover a single shift during the strikes. And what's worse is they're doing it in tandem. So one doctor covers for a colleague, receives that vast payment. The next day, they swap roles, and then that doctor gets the same payment. That cannot be right. And let me tell you, the cost of providing locum cover up to August of this year has been in excess of £1 billion. That is our money. It's money which should be going into patients' care. It should not be going into a political movement. Now, Phil Banfield, who's the chair of the BMA Council, said if this government was serious about patient safety, it would not have deliberately run down the health service over the last 10 years with the terrible adverse effects that austerity has had on the health of the nation every day. Let me tell you something. That is propaganda, and it's simply not true. When you look at the management of the NHS has never had so much money. We spend 11.7% of GDP, roughly the European average, on the NHS, and our outcomes are dreadful. 1 million patients in England have experienced a delay in their cancer care since Rishi Sunak became Prime Minister just 10 months ago. Our survival cancer rates for 9 out of the 10 most common types of cancer are lower than European countries. And because we're missing all of our targets, instead of dealing with the problem, guess what the government's done? The government, in its infinite wisdom, has now decided to scrap 2/3 of the targets. So 10 targets are now reduced to 3. We should never have been locked down in COVID. The government panicked. You see, this is a lack of political leadership. The government panicked. They believed the modelling. That simply wasn't true. And now it transpires, it's worse than that. They actually cherry-pick their evidence to reinforce their insane draconian rules. The government presided over a catastrophic policy of discharging patients from hospital into care homes, and they didn't test them for COVID. And all of us now know the devastating results that occurred as a result. They consigned elderly people to death. And I say this, at best, this government is presiding over a system of mediocrity. At worst, it's catastrophic failure. And between the government and these militant unions, if they continue at this rate, there will not be an NHS left to save. It has gone from a national health service to a national health shambles. And as you can tell, I'm deeply passionate about this, and I think there are 3 problems that we need to solve. They are staff, systems, and technology. Let me start with staff, because underpinning all of this industrial action is really deep unhappiness And I understand that. And I really do think we should pay doctors more, especially junior doctors. But it's more than that. It's not just money. It's about how they feel. They need to feel appreciated. They need to feel loved. They need to feel supported. And they don't get that at the moment. We need to provide simple things like hot food, on-call accommodation, training opportunities, and really good prospects. And fundamentally, and we've been saying this, Richard has said this, I've said it for a long time now, we need to train more doctors and stop nicking them from abroad. And guess what? The government is now listening to Reform UK because that is now Rishi Sunak's pledge. I'll tell you what, it was a Reform UK pledge. But we also, on top of that, need to make sure we're training the right people to be doctors. I do not want to accept those people from good families where mummy and daddy believe Tarquin and Fifi should get their prefix. What I want to see, and what we want to see, is recruitment from the inner cities, from those people who really know what it's like to struggle, to fight, who understand poverty, who understand deprivation, and we need to empower them. And this is how we do it. What we need to do is to remove the insane amount of debt the training causes. So at Reform UK, we believe passionately that the government should enter into a contract with the students where, on qualifying, they are then bound to serve 10 years in the NHS. And in return for this contract, when you pledge 10 years of your life, what we will do is underwrite the cost of their training. We will pay down their debt as they then serve in the NHS. And the same isn't just for doctors. Same for nurses, for radiographers, for physiotherapists, and so on. What we'll do will make their lives and their prospects better. And what that will also do is engender loyalty and thanks to the NHS. What's more, we will also solve the staffing crisis and will also stem the exodus of trained staff leaving for foreign countries so early in their careers. One other thing, we need to rid the NHS of the insane amount of managers. 48%. 48% of the staffing budget is non-clinical. That is wrong, it's immoral, and it must stop. We also need to cut out the waste, the bureaucracy. We also need to cut out the inefficiency. I feel also deeply passionate about this. We need to let doctors exercise clinical judgment and let them take the decisions. We also, at the same time, need to allow nurses, allied healthcare professionals to make clinical decisions, not managers. I don't need to tell you this, but the NHS is an oil tanker, and it's very, very slow to turn it around. It's actually worse than that. It's not one ship. It's many vessels, all with different destinations, all with different navigation systems. When I trained at that hospital down the road, the NHS was one organisation. It was then split into self-governing trusts, each with boards and management. They then grew. As they grew, they took over each other. They created bigger trusts, and they created monoliths. As they've done that, we're now in the insane situation. We're almost back to where we started. We have actually replicated the picture of the original organisation, but we have added far more managerial structures and far less efficiency. Some bright spark thought it was a great idea to cut hospital beds whilst the population increases. We had 300,000 beds in this country. We have 140,000. Now, let me tell you this. As a doctor, if you haven't got a bed, you can't admit anyone. So you can't admit anyone from A&E because obviously you haven't got any capacity. That means you can't actually operate on anyone because you haven't got any beds. So the whole bed crisis is exacerbating what is actually going on in A&E. It's a very simple game. If you haven't got capacity, you can't move anyone. So no beds, that means everyone's stuck in A&E, which means the ambulances are on the ramp. That means that no one comes in. That's why the ambulance response times are so long. So what do we need to do? We need to invest in social care, because there are lots of people stuck in hospital who don't need to be there. If we don't have social care places and a joined up system, we can't discharge the elderly. If you can't discharge the elderly, you have no beds. And so you understand the picture continues. As well as doing that, we also need to invest in primary care. We need to get away from small general practice sort of organisations. We need to see big diagnostic and treatment centres. We need to open them every day of the week, and we need to relieve pressure on A&E. And what we need to do is we need people to remember this maxim. I unveiled it last year. Pharmacy first, GP second, and A&E last. And the other thing that we need to do at the same time is need to remove the vested interests from the system. Fundamentally, and I spoke about this on the show this morning, fundamentally we need to stop being so short-termist. We need a 20-year cross-party strategic plan. I'd go one step further, actually. I would go so far as to say we need to depoliticize the NHS entirely. And whilst I'm at it, let's stop being so woke, shall we? I want to see single-sex wards, stop painting rainbows in the car parks, and stop being obsessed with pronouns and virtue signalling. And what on earth is an NHS ambulance trust doing, giving men a year off for believing they have symptoms of the andropause? Now, the andropause, in case you don't know what that is, it is the male version of menopause. Now, look, many doctors can't agree whether it really exists, but some men, sure, have a reduction, all men have a reduction in testosterone from the age of about 18. The problem is here, if you have clinically a reduction in testosterone, it's really simple. If you're symptomatic, you treat the symptoms and you get back to work. And please, can we stick to biology? Can we talk about breastfeeding, not chest feeding? Also, let's not pretend there are 50 sexes. There aren't. There are two. They're male and female. You know it, I know it, it's common sense, and also it's biological fact. And that brings me to my third point, which is technology. We must embrace technology. At the moment, we have multiple IT systems that don't talk to each other. When we want to do things well, though, in this country, we really are world leaders. Now, whether you believe the policy in COVID was the right one, what the COVID pandemic taught us is that patient-held medical records, like the COVID pass, were rolled out seamlessly and worked brilliantly. But what we need to do is to work out which are the great projects. We need to stop wasting money on spurious IT projects. We need to work with world-leading companies to ensure that your data, patient data, is safe and secure. And because as a country we seem to have such an ostrich mentality about adopting technology, and we also have such an excellent track record in messing everything up, the NHS has spent more than £1 billion on storing paper medical records in the past 5 years. £1 billion on paper records. That's money that should be spent on frontline patient care. So let's move on to Reform UK and what we believe in, because we believe passionately in patient choice, in convenience, and in flexibility. You should be able to see a doctor of your choice when and where you want. Reform UK believes that waiting lists must be abolished. And to do that, the NHS has to work with private providers. The money then follows the patient. Reform UK will unleash the power of the private sector to dramatically increase the capacity and slash waiting lists. And here's our pledge. If you can't see a GP within 3 days, you are then entitled to use a private GP paid for by the NHS. If you can't see a specialist within 3 weeks, you can then go to a private specialist, again the NHS providing the funding. And if you have to wait more than 9 weeks for your operation, not 2 years, not 3 years, not 4 years, 9 months, then again you can go privately and that bill will be picked up by the NHS. So just think about it. What does this actually do? What it means is great service provision will be rewarded, allowing great operators to grow, improving competition, and improving choice for you and for me and for the public. We also believe that tax breaks should be given to encourage people to take out private healthcare. It is absurd that currently you cannot offset that cost against tax. Now, if you made that change, more people would take out private medical care. That reduces the burden on the NHS as well. We also need to empower the public to use technology, and I want to see rewards, rewarding great behaviour, rewarding healthy eating and drinking. Stop telling people what to do, encourage them what to do. And we need to encourage exercise and discourage a sedentary lifestyle. In summary, let me just tell you, almost every health policy that I've come up with, that Reform UK's come up with, that our health committee has come up with, has been copied by the Conservative Party. And in many ways, I guess, we should be flattered. And here's the telling point. When they do adopt our policies, the Conservatives go up in the poll ratings. And what does that mean? Well, it means that we are right. But here's the really salutary lesson. The Tories are all talk and they are all bluster. Nothing will change under the Tories. If we truly, truly believe in the concept of the NHS, if we want the NHS, if we need the NHS, then the whole system must be reformed. The time, I think, for idle talk is over. It is now time for delivery, and it's time for reform.